Southeastern Med, in association with Dr. Thomas Picklow and Dr. Cliff Maximo, invite you to discover the latest in advanced outpatient procedures. Greenlight Laser Therapy. Benign prostatic hyperplasia, or BPH, is a non-cancerous enlargement of the prostate gland, and it affects half of all men over the age of 60. Historically, this condition has been treated with medication. Today, men with BPH have the opportunity to choose a minimally invasive surgical treatment known as Greenlight Laser Therapy.
Back in the early 90s, I started doing laser therapy. I was one of the early adopters of this type of procedure, and I've done several hundred. In fact, I've even done some national speaking and training for the procedure. Urologists do the Greenlight laser procedure in patients that have a number of symptoms. These include urgency, frequency, getting up a lot at night, and sensation of incomplete emptying. We like to use the Greenlight laser as either in conjunction with or as an alternative to medications. A lot of patients would rather not take medications their entire life, would prefer to have a surgery, have it done at one time, and have the procedure completed so they can void normally without taking medications. When the patients come into the urology office and complain of symptoms of urgency, frequency, and getting up a lot at night to urinate, we offer them medical therapy to see if we can improve their symptoms without surgery. Sometimes that doesn't work, and then we offer them the Greenlight laser as an alternative to medication. I perform the Greenlight laser surgery in an outpatient setting. Very rarely do we have to admit patients after the procedure. After laser surgery, some people are concerned as to whether or not there are any major complications. Two of the most common questions I have are, will it affect my ability to have intercourse? And the answer is absolutely not. In addition to that, patients are wondering whether or not they may have incontinence. And when the patient has bladder blocked off for a number of years, they do get bladder urgency. And after the procedure, there may be, in fact, a short period of time where they do have more urgency and even some temporary incontinence, but very rarely is that a permanent feature. I like to let my patients judge the success of the procedure. Usually after when I'm done with the operation, they tell me after several weeks of recovery that they have less urgency, frequency, they're able to sleep through the night, and it really changes their lives. Patients currently taking medication for BPH can often experience side effects from the medication, including dizziness, visual problems, nasal congestion, sexual side effects, and possible medication interactions.
I've been performing the Greenlight procedure for the past 5 years. I was one of the first surgeons in Ohio to perform the procedure. I've performed over 300 Greenlight surgeries for treatment of BPH. The Greenlight laser surgery is performed in the hospital as an outpatient procedure. It usually takes less than an hour, and patients are able to resume their normal activities in 2 days. One advantage of laser surgery is that a patient typically can discontinue their medications that can be costly. By providing this surgery, we actually may allow the patient to discontinue their medications for the rest of their life. So with the Greenlight laser surgery, we actually remove the tissue to allow better urine flow and return to normal voiding symptoms. I usually tell my patients that they're the judge of the success of the procedure. And out of all the surgeries I offer to my patients, this Greenlight surgery provides them with the most satisfaction.
Today I'm performing the HPS Greenlight laser procedure. As you can see, it's done here in the operating surgical suite. The procedure is performed in an outpatient setting with the expectation that the patient will be discharged home after surgery. What follows is a video of the laser vaporization process.
Greenlight uses laser energy to remove enlarged prostate tissue. This results in an open channel for urine to flow through, but with fewer risks of sexual dysfunction and other side effects common with TURP. In addition, more than 250,000 patients have been treated with Greenlight. Greenlight offers a definitive, long-lasting solution for patients with BPH. Greenlight is a quick outpatient procedure that delivers immediate and dramatic symptom relief without the side effects or expensive medication or the risks associated with invasive surgery. Most patients return home a few short hours after the procedure and can return to normal, non-strenuous activities within days. Of the BPH treatment options available, Greenlight has the widest patient selection and is an option for most patients suffering from an enlarged prostate. Greenlight's safety and efficacy has been established in 80 clinical articles and 97 abstracts. And now a few words from our local patients. Why did you decide to have the Greenlight procedure?
Well, I went to the doctor, Dr. Picklow, and he told me my prostate was enlarged to the point where it may be blocking my flow. So he put me on medication, and the medication didn't work. And he said the only other option was to operate, and that they had this new system that they were utilizing rather than actually cutting. So he gave me paperwork to read, talk to my wife. We decided to go ahead and go along with it.
Well, I had been facing the fact that I was going to have some type of procedure done for typical prostate symptoms, and I discussed this with Dr. Maximo. He outlined the various procedures which were available, and after we discussed this, I decided that the Greenlight procedure probably offered the best chance of treatment of the problem with the least possibility of complications and side effects.
I was having problems urinating, going several times a day, getting up at least twice a night, and the medication wasn't doing its job, and that's the reason I decided.
How did the Greenlight procedure improve your quality of life?
My quality in life, once I had the operation, was 100% better than what it was before. I couldn't even drive from here to Zanesville without stopping once or twice to use the bathroom.
The recovery process has gone well. It's freed up my activities quite a bit. It has allowed me to travel freer. As you might understand, that traveling can be a problem when you have a problem with urinary frequency.
Oh, I don't know whether I can tell you. It's so much. One thing, stress, sleeping at night. I sleep 8 hours a night. I sleep all night, maybe once in a blue moon have to get up during the night. I have no medication at all for prostate problems now. I can go to a ball game with my grandson and sit through the whole first half without running to the bathroom. Go out on my boat and fish for half a day. Don't have to worry, so it greatly improved it.
How was your office experience?
And I was quite impressed with the staff that they have there to work with. They were all very professional. They explained everything in detail as to what they were going to do and when they were going to do it, and you couldn't ask for a better situation to be in.
Well, it was very good. They were friendly, cooperative, and if I had any questions, they were always available to answer the questions, and I would say it was very good.
Dr. Maximo and his staff are just wonderful. Always got a smile. They're professional. They know what they're doing, and they're just gracious people.
Would you recommend the Greenlight procedure?
The procedure wasn't that long at all, and I would definitely recommend it to anyone who has any kind of problems utilizing the bathroom, because like say, I was given a prescription after the operation. I didn't need it. I had no pain whatsoever.
Yes, I would. Everyone has their different expectations and fears of surgery, and I'd have to, consider each person's what they expect to get out of it. But in general, I would. Yes. In fact, I have recommended it to several people.
And any friends or anybody that I know that's having the problems that I had, I highly recommend it.
Southeastern Med and Dr. Thomas Picklow and Dr. Cliff Maximo thank you for allowing us to share this information with you. For further information, please call 740-439-8839 or visit us on the web at www.seormc.org.